to give a quick summary of what Zipline does, we build an instant delivery network for medical products. And we do that using small 40-pound electric autonomous aircraft like the one that you see here in this photo. And the reason this seemed like a really good thing to spend our lives doing is that healthcare logistics today really only serves the golden billion people on the planet well, and the other 6 billion are largely ignored. And as a result of that, about 5.5 million kids die every year due to lack of access to basic medical products. And that just seemed like a crazy thing to be happening in this day and age. So whenever we talk about drone delivery, I think people still think that it's largely science fiction. So let me only talk about what we're actually doing today. This is a map of the country of Rwanda. Today, Zipline is delivering about 60% of the national blood supply of Rwanda outside of the capital. We're doing that from 2 distribution centers, which are the 2 Zs that you can see in this map. Zipline hires all of our own operators and operates those distribution centers. And the transfusions that we're delivering, 50% of them are being used for moms with postpartum hemorrhaging, and then 30% are being used for kids under the age of 5. So this is a really, really important product, especially for family health. And today, this is actually the largest commercial autonomous system anywhere in the planet. It's happening in Rwanda. You can see all of the little blood icons on the map are the hospitals, and then probably even harder to see are the little gray dots, but that's about 500 primary care facilities that we've been adding to the network over the last couple months. So would you like to see how it works? OK, cool. So this is not fancy. I took this video on my cell phone, but this will give you a sense. This is a Zip, which is one of the vehicles flying by one of the hospitals that we serve. We deliver from about 10 meters up. And we can deliver into their mailbox, quote unquote mailbox, which is about 2 parking spaces on the ground. And they can set that mailbox up wherever they want. We also take the wind into account. So even when it's really windy, the vehicle can deliver in a very precise way. You can see these women are like, what the hell did we just see? Relatively shocked, but you'd be amazed by how quickly something goes from science fiction to like totally normal. And of course, we have drones that deliver all the urgent medical products we need. The really cool thing about this is that we now have 2 years of operating data operating at national scale, and that typically healthcare logistics networks have to balance access against waste. If you want to deliver a lot of product to the last mile, you end up throwing a lot out, and then vice versa. If you keep more centralized, patients end up dying when they don't have access. But Rwanda has actually been able to show that you can reduce waste from 6% to 0. They're the first country in the world to achieve that. And they did that while increasing access to blood products by about 172%. So really, really cool. And obviously, even more important than that is the lives that this impacts. I mean, Zipline has been able to do nearly 4,000 life-saving emergency deliveries in the last year alone. This is Alice, a mom who was giving birth at one of the hospitals that we serve. And we ended up delivering 6 units of platelets, I think it was like 6 units of red blood cells and 4 units of platelets and 2 units of plasma, all of which was transfused into her on an emergency basis. And the doctors were able to save her life. So let me just show you really, really quickly, let you actually hear from the people who are running this system and the patients who benefited from it.
Zipline is divided into different teams. We have the flight ops, who care about pre-flighting planes, packing and routing the packages and make sure that the plane can fly. Then we have health ops. You can deploy more of the people with the knowledge of the blood product.
We make order to Zipline by using SMS or by using WhatsApp.
The package is handed to flight ops. You scan the package and that's when you put the vehicle in launcher. The vehicle will fly autonomously up to the hospital.
Iyo ntabona ayo maraso nari gushobora igihe baba basaba amaraso n'igihe tugereyeho ntabwo bitabiriye ndabona amaraso kumara nahita amaraso ko ari yagize umuntu.
We can avoid expiries, we can avoid stockout because the supply chain has improved. Blood is life. It is saving life. Rwanda is
So just to give you a really quick sense for how, or first of all, it's just worth mentioning, these are a couple stories, like a few of the patients that you're hearing from. But one of the most powerful things about what we do is that when you can help a doctor save a mom's life, you're also impacting the life of that child who's going to get to grow up with a mom. Just to give you a really quick sense for how some of this technology works, we've had to build all of this from scratch. So we designed the aircraft, we designed the flight control algorithms, the launcher. This vehicle is accelerating from 0 to 100 kilometers in about half of a second. There are obviously no runways where we operate, so we have to find new solutions to all of these problems. Landing the aircraft is even more challenging. We need to decelerate the plane from 100 kilometers an hour to 0 in about half of a second. And so you may want to take a guess as to how that works. We used to actually aim for about a 1 meter target on the vehicle, but since then our flight control algorithms have gotten so precise that we're now aiming for about a 1 centimeter target on the airplane. So we're aiming for 1 centimeter. It's a very small hook on the back of the airplane. You'll see how this works. We actuate the recovery system up. We can grab the airplane, decelerate it, and swing it down. And we can do this about 500 times a day. So this is kind of like a newer version of an aircraft carrier, repurposed to make healthcare work for the entire world. And one really cool thing I just wanted to quickly share, this is actually just a screenshot of the iPad that we use to control these vehicles. This is just from 2 nights ago. We actually had an emergency event at one of the hospitals that we serve and had to send 8 aircraft out all at the same time to make deliveries. And we're tracking these aircraft over the cell network, which actually works quite well. So you can see 6 of these aircraft are still outbound, waiting to making deliveries, and 2 are now inbound, meaning they've already made deliveries and are coming home. What's really cool is that the work that we've been doing in Rwanda is now spreading. So just a few months ago, we announced that we're partnering with the government of Ghana to build 4 distribution centers and serve 20 million people. We are officially launching the first distribution center on April 24th. And we're going to be delivering all medical products to all of those 20 million people. So this is a really exciting way that countries can actually achieve universal access to healthcare in a way that's way more economical than has previously been possible. And these distribution centers that we set up to do this, we can now set them up in about 4 days. The last one that you see here took us 4 days. We're going to be launching in Israel toward the end of the year, and in the next few weeks we'll be announcing our first big partnership with a healthcare network in the US. And the reason that we're so excited to be launching in a place like the US is that when we really think about what is the long-term potential of healthcare access, especially in rural parts of the US that are really, really challenged, we think you ought to be able to pick up a phone, have a video chat with a doctor, have the doctor figure out what you need, and then have that product show up at your doorstep 5 minutes later. Like that, for us, is a really exciting vision of what healthcare could be and how we could equalize access to healthcare between people who live in cities over time. Sorry, cities and rural places. So just in conclusion, I got to spend time at the Mayo Clinic a few months ago and was super blown away by how impressive and incredible of a hospital it was. But the reality is that most people on the planet, this is their experience of healthcare. This is a primary care clinic in East Africa that sees over 1,000 people a day. And so it's now possible. Technology has gotten us to a point where we can deliver products, especially medical products, as quickly and efficiently as the internet delivers information, and do so for every human on the planet. But we don't think that the long-term impact of that technology is delivering pizza or burritos. We think that the really exciting potential of that technology is providing universal access to healthcare for every single human. Thanks.